for all the participants. Then I'm very happy that Madam have accepted our request. She is very busy looking after the health center in Mizoram University. So every now and then all patients are coming in and out. So she's quite busy. In spite of that, she has given time for our participant. Thank you so much, ma'am, for having you. You may proceed with your lecture, ma'am.
Thank you so much. Okay, lifestyle diseases and management. Okay, good afternoon, everyone. Uh, like Sir Omoya has already introduced me, so I will introduce myself. We'll just go ahead with the presentation. One, one second, my screen.
Yes, ma'am. Your screen is visible.
It's
Let's
visible,
see
but
whether
it's
it's
not
changed.
moving. Wait,
Yes, it's not moving, ma'am.
yes.
Is it moving now? Sir.
Yes, it's moving. It's moving.
Okay. Okay, sorry for the glitch. So let's start. Okay, lifestyle diseases and management. Uh, now, what is a lifestyle disease? Lifestyle disease is a disease which is associated with how a person or a group of people lives. So, as majority of these diseases, they are non-communicable. So, they are also referred to as non-communicable diseases or what we call NCDs. Now, what do you might ask, what do you mean by non-communicable and communicable? Communicable diseases are those diseases which can be passed on from one person to another by close contact. Like you have your common cold. If a person has a cold in a room, person next to the person can also have cold. Like it can catch the cold. These kind of any viral infections, these are all communicable diseases. But what we're going to talk about is about non-communicable diseases your diabetes, your heart attack. These are something which you cannot communicate from one person to another just sitting together in one room. Okay, so that is the simplest form on how an explanation on what do you mean by non-communicable and communicable diseases. Now, all lifestyle diseases have one common property, that is cell hypoxia, which is the driving force of all lifestyle diseases. What do you mean by cell hypoxia is that the cells in our body, they require oxygen. Okay, they require proper oxygen, a proper amount of oxygen. But when there is decreased oxygen in our body, the cells do not thrive properly, and this leads to all these lifestyle diseases. That's why the cell hypoxia is the driving force of lifestyle diseases. Now, you have different risk factors. Like you have the controllable risk factors. These are risk factors which you can control. Your diet, your body weight, your daily levels of physical activity, the amount of exposure to the sun your exposure to the sun, then your smoking, your alcohol abuse, drug abuse, everything. All these are controllable risk factors. These are something you yourself can control. Then you have uncontrollable factors which leads to lifestyle diseases, like your age factor. These are some things which are beyond your control. Then you have your race factor, then you have your gender factor, then you have your hereditary factors. These factors are something which are beyond your control. Then, see, all these lifestyle diseases are due to your improper lifestyle. Now, what is improper lifestyle? You're overeating, excessive consumption of fats, sugars, smoking, drinking, chewing tobacco, sedentary lifestyle, lack of exercise, all these come under improper lifestyle. So you are if you come under any of these points, that means you are following a very improper lifestyle. Now, types of lifestyle diseases. What are the different types of lifestyle diseases? You have obesity, cardiovascular diseases, stroke, diabetes, cancer, chronic obstructive pulmonary diseases, depression, musculoskeletal disorder. So what I'm going to do is I'm going to talk about these diseases briefly. We'll just go fast, and so that you'll have a sort of an idea of all these kind of diseases and how to prevent them and what causes all these lifestyle diseases. Now let's start with obesity. Now, obesity, as you all know, you know what is obesity. You have an idea of what obesity is. Now, obesity is considered a disease. Okay, it has been more precisely defined by the National Institute of Health as a BMI. That is, BMI means your body mass index of 30 and above. So if your BMI is above 30 and above, that means you are obese. Now, how do you calculate this BMI? It's a very simple calculation where you use a person's height and weight. So you try to know the person's weight in kgs. You try to know the person's height in meters square. So what is BMI? BMI is basically you divide the weight in kg by the height in meters square. Now, in a normal person, your BMI should be about 18.5 to 24.9. In an overweight, it should be 25 to 29.9. Now, in obese, like we said, it should be obese, it's 30 and above. But if your BMI is also less than 18, that means you're underweight. Now, let's go to what are the diseases which is related to obesity or obesity-related diseases. Now, type 2, you have type 2 diabetes. Then you have hypertension. Then you have heart diseases. You have stroke. You have infertility, abnormal menses, PCODs, and pancreatitis. Then you have breathing problems. See, obesity can also cause breathing problems. Then you can have even if you're not taking alcohol, but if you're obese, you can have a non-alcoholic liver disease. And then cirrhosis, you can also have cirrhosis. And then you can also have gallbladder diseases and physical disability, sleep disturbances. It can also lead to breast, uterus, cervical cancer in females, and in male, colon or prostate cancer. So obesity is related to many chronic health problems. Now, obesity in children, especially nowadays, what happens is that our children are very inactive. They're glued to their phones, their tablets, their computers, and you have your video games or whatever, like PlayStations or whatever. They're all glued to that. So there are people, our children, and we have such easy access to fast foods that most of our children have become obese. So this is a very crucial time in their life, and obesity in children can lead to so many things. Like if 70 there's a 70% chance that if they're obese during their childhood, they'll be obese in their adulthood. And then you have they're prone to they're prone to type 2 diabetes, childhood onset type 2 diabetes. And if they have childhood onset diabetes and later, it can affect their kidneys. And when they talk about blindness, it's usually because diabetes cause a lot of problems in your eyes. You can have retinal detachment, which later leads to blindness, and so on. And there's also 61% of overweight 5 to 10-year-olds have at least one risk factor of heart disease, and 26% may have two or more risk factors of heart disease when they grow up. So what is the key factors related to the onset of obesity is poor dietary practices, decreased physical activity. Now, let's go to the next one, which is cardiovascular diseases. Cardiovascular diseases are diseases or disorders that result from damage to the heart and blood vessels. Now, common cardiovascular diseases are high blood pressure, heart attack, coronary artery disease, which is narrowing of your arteries. When we're talking about narrowing of your arteries, coronary means your heart, so narrowing of the arteries in your heart. Now, what is the difference between a heart disease and you might ask, what is the difference between a heart disease and a cardiovascular disease? When we talk about a heart disease, it refers specifically to the heart. And when we talk about cardiovascular, cardio is the heart part, vascular is the vessels part. That's your blood vessels. So it's any disease which it refers to the heart and the blood vessels together. Then we're going to talk about in heart diseases, in cardiovascular diseases, the most important is atherosclerosis. These atherosclerosis are the culprit causing your heart attacks, causing your stroke. So what is atherosclerosis? These are accumulation and buildup of plaque. And what is plaque? It is a sticky substance which is made of fat, cholesterol, calcium, etc., which we take in through our food. So if we take too much of calcium, too much of fat, too much of triglycerides, too much of oil, these get absorbed in our blood. They form a sticky substance called plaque, and this leads to atherosclerosis. So accumulation and buildup of plaque inside the arterial walls will cause hardening. It'll harden the arteries. See, arteries are supposed to be elastic. They're supposed to stretch. And so what happens when there's hardening and narrowing of the arteries cannot stretch. And, even if there's a high pressure of blood coming. So what happens in normal arteries when there's a high pressure of blood flowing through the arteries stretch and it accommodates the high pressure of blood and that flows uninterrupted. Now, if the lining of the arteries have become hardened, they become less flexible, they cannot stretch, and then it becomes narrow, and the flow of blood through that is also small. And so the flow, that's how we end up having blood pressure. And later, if there's something blocking the arteries, you can have your heart attack or your stroke. As artery thickens, it can restrict blood flow, leading to, blood clots, heart attack, and stroke. Now, atherosclerosis. Look at this picture. You can see these three pictures. One is normal. There's a tear in the lining of the artery. See, this is a normal flow. And there's in the middle one, you can see there's a tear in the lining of the artery. And then through that, you can see that fat, cholesterol are entering and it's accumulating there. Now, these are causing the narrowing of the lumen of the artery. That means the pathway of the artery. See, there's another picture here. Here, this is a cut section of a coronary artery. There you see the normal artery there. And then second picture on the right side, upper right side, you see there's a tear in the arterial wall. And you can see that yellow part, there's a deposition of the fat materials and all that, what do you call it? Dirt, you call it, fats and cholesterol and triglycerides and your calcium and your there are lots the toxins, whatever, that there's a tear there, then it gets accumulated there. See, and you can see that on the lower left corner, you see that the lumen, the opening, the pathway of the artery has become smaller, and that the whole yellow part is the deposition of those materials, fatty materials. And if there's a blood clot coming, see, it blocks the artery, and blood cannot flow through that. That is what happens. And then see here, there's another picture of the heart. You can see the coronary artery. There's a blocked coronary artery there. And if you can here, you can see what happens in a heart attack. The artery is blocked by that blood clot. On the left upper side, you can see the picture there. There's a blood clot. Those are cholesterol plaques there. They narrow the lumen of the artery. So there's a block. There's a blood cannot flow through that artery, and the area of the heart which that artery supplies will not get enough blood flow. And so what happens is that that area will get there'll be what we call ischemia. Ischemia means it's not getting enough blood, so that part of the muscle will dry up. So what happens is that then the muscle will start dying. That's a dying muscle. You can see the picture there. That's what happens in a heart attack. Now, how are these blood clots formed? It happens because the platelets, we have in our blood, there are three types. We have three types of blood cells. We have the red blood cells, we have the white blood cells, and the platelets. Now, these three types of cells have different functions. And you know what the red blood cells do? The red color is because of the presence of the hemoglobin, and these are the ones which carry the oxygen from the lungs to the heart, and then deoxygenated from the, like it goes on. So those red blood cells are the ones carrying the oxygen. Then you have the white blood cells. Now, what do white blood cells do? White blood cells, as in layman term, you can say they are the like the warriors, the soldiers. They are the security guards. They are the ones guarding our blood from infections. Then you have another type of another cell. That's the platelets. Now, what do the platelets do? Platelets are the ones which prevent which helps in clotting. Like you cut yourself, and after some time, you see that your blood has clotted and there's no more bleeding. Now, why is that? It's because of the action of the platelets. So platelets are very, very important too. So what happens is that these platelets, they begin to clot the plaque, but that area that in the artery that where there's the accumulation, so they begin to clot that area which has formed on the artery. So and sometimes what happens is these blood clots, if the lumen of the artery, if the pathway of the artery is not so narrow, initially it wouldn't be so narrow. There may be a clot formation, but the pathway is still not so narrow. So what happens is that it will flow together. The clots will move together with the blood flow. But it will sometimes what happens is that it may get caught in an area where they cannot pass through. And that is when you get your stroke or your heart attack. Now, when there is blockage in the arteries located in the heart, you have your heart attack. Now, heart attack warning signs, just you can have feeling of there's pressure on your feeling of intense pressure on your chest, squeezing pain, or pain on your chest. It's like someone sitting on you, or there's a heavy band. It's like if you put a heavy band around your chest and you tighten it, that kind of feeling. Then second is there can be pain which radiates around your jaw, your neck, your arms, or shoulders, your back. You might also have shortness of breath. A shortness of breath means difficult. You feel your breath is caught somewhere, like in your chest, and you cannot you cannot breathe properly, and you might have nausea. Nausea means that vomiting sensation. Then you can have sweating and feeling very faint, and if you feel like you're going to faint, that feeling very uh, you feel as if you're going to fall any moment. So these are warning signs, but this does not mean that just because you have this that you're going to have a heart attack, because there are also other similar things which also mimics these kind of symptoms and signs. But whatever it is, if you have if you have any chronic diseases, like you're diabetic, you're hypertensive, or you have a family history of that, and you're obese, or like you're and you have not been uh, investing, you checking your blood reports, and yeah, having your annual checkup or whatever regularly. So if you have these kind of warning signs, just go for a full body checkup. That's my advice. I can't say just because you have that you're going to have a heart attack or whatever. But what I feel is that if you have a chronic illness, or even if you don't have a chronic illness, it is good to go for an annual checkup every time, so that you know your condition, you know where you stand, you know what your parameters are. Now, what should be done when let's say a person has a heart attack? You have the victim sit down and rest, and you attempt to keep him calm. Yeah, the calmness is one most important thing. And you loosen any tight clothing that the person might have. And if the person is somewhere else and he's planning to go home, he says, I'm not feeling well, but he's planning to go home. Best is you ask you drive the person yourself, or you ask the person not to drive. You call someone to drive for him, and also you ask the person not to walk. Okay. Now, if the victim has already had a heart condition, or he's on some medication, ask him what medication he's taking, and you assist him with his medication. Now, if not, what you do is swallow the packet of loading dose with a tumbler of water. I'll the next slide, I'll show you what is a loading dose. Okay. Then, or you call for an urgent medical help, or you take the victim to the nearest hospital. Now, what do you mean by a loading dose? Now, loading dose for myocardial infarction. Myocardial infarction is a medical term for heart attack. Basically, what we call an MI. Okay. Now, the loading dose consists of tablet atorvastatin 80 mg or rosuvastatin 40 mg, one tablet. Okay, a tablet of atorvastatin 80 mg or rosuvastatin 40 mg. Then there's another tablet, a tablet of clopidogrel 300 mg or 600 mg. Okay, and then another tablet, aspirin. Tablet of aspirin 325 mg or cosprin 325 mg or disprin 325 mg. So a tablet of each of these medicines. So you keep these 3 tablets in the small packet and you carry with you for emergency. Always carry with, and always check the expiry dates. Because see, you're not going to take it. It's not something which you're going to consume it, so it's like it's an emergency tablet. So you in a small packet, you keep the 3 tablets keep the 3 tablets, and you write the expiry date, so that it's easier for you to check when the medicines are going to expire. So if the expiry date is near, then you keep on then you change you change the medicine before its expiry date, and always keep this with you, because this has prevented a lot of uh, heart attacks, especially in places where it's not accessible. So if you carry this tablet with you, and you feel you're having, let's say you're diabetic patient, you're a hypertensive patient or whatever, and you feel you have those symptoms coming, it's you feel like you're getting those kind of symptoms, just take these 3 tablets, and then go for a checkup. Go to the nearest hospital. Vulnerable people who may develop a heart attack: diabetics, hypertensives, smokers, living sedentary lifestyles, those above 40 years. Like, of above 40 years, what I suggest is a person who is above 40 years, even if you have been healthy all throughout, no issues, you haven't had any issues. But my suggestion is that if you're above 40 years, I feel you should always have an annual medical checkup thoroughly. Then you have obese individuals. Then you have those people with high cholesterol level, family history of heart attack, having stressful job and a lot of mental stress. Okay. Now, next we'll talk about high blood pressure and stroke. Now, what is blood pressure? When your heart pumps, it forces the blood through your vessels, and this force is what is called the blood pressure. Now, what happens is that when your heart is pumping and it's forcing blood through your vessels. Now, if your vessels, like we talked just before this, we've talked about how the blood vessels can get narrowed and hardened because of the position of plaque and because of atherosclerosis. So what happens is that when your heart is pumping the blood and it's forcing the blood through the vessels, and these vessels are diseased, like it has those plaque formation, and the vessels have been hardened. So what happens is the force, there's a massive, the heart has to really force the blood through those vessels so that the blood flows through your other parts of the body. Now, because the force is massive, the heart really has to pump it. That's why you have your high blood pressure, because the heart is walking harder than normal to force the blood through your vessels. Now, the other risk factors of hypertension: lack of exercise, increased salt intake. Yes, this is very important because salt contains sodium, and this increases your blood pressure. Now, family history was alcohol, smoking, stress, and age. As we grow older, our blood pressure also increases. Now, the effects of hypertension. The common target organs damaged by long-standing hypertensions are, your brain is affected. You can have because of your high blood pressure, your brain gets affected. You can have a stroke. Then your heart, like we said, because heart attacks, and then kidneys. You can have a chronic kidney diseases. Then your eyes, you can have a lot of complications in your eyes because of high blood pressure. Then even your peripheral arteries, these are all affected. You can have a blockage in in your peripheral arteries. When we talk about peripheral arteries, means the arteries on in your peripheries. That is your legs, your arms. Now, the range of blood pressure. This is according to the American College of Cardiology. Here, mm, when we talk about blood pressure, we talk about systolic and diastolic. Now, what do you mean by systolic and diastolic? Is that when we talk about systolic, when you ask a person, what's your blood pressure? They might say, okay, my blood pressure is 120 by 80. Now, why do we say 120 by 80? 120, the first number is the systolic pressure, and the 80, when we talk about the 80, that's the diastolic pressure. Now, what do you mean by systolic pressure? Is that systolic pressure is the pressure which is recorded when your heart is contracting, when your heart is working. And diastolic pressure is the pressure which is recorded when your heart is at rest. So usually, uh, your let's say your normal blood pressure is 120 by uh, 80. That's we consider it as normal. Now, you've been running around, or you've you've just received a very uh, uh, what do you call a very bad news, and you're stressed out, and when you check your blood pressure at that point, what happens is that your systolic usually may be higher than your normal. It may just go up to 140 by 80, but it does not mean that you're hypertensive. It just shows that because you're stressed, or because you're tired, because you've been running around and your heart is still pumping, your heart has not rested, and it's still working overtime. That's why your systolic pressure reading can be a little high. But if you rest for 10 to 15 minutes, or even half an hour, and then check your blood pressure again, it'll come down to its normal 120 by 80. Now, that is just a normal occurrence. Okay. Now, let's talk about what we consider normal. Normal is usually when your systolic pressure is less than 120 and your diastolic is less than 80. Now, we talk about hypertension stage 1, which is like, what we would call, though we do not medicate, but at hypertension stage 1, we ask the person to be more aware. It's like a warning stage, like in a warning stage where the person should be aware that you have tendency to develop a high blood pressure if you do not control your diet and your lifestyle. Now, then you come to hypertension stage 2. This is when we usually say, okay, you might be have you have hypertension and you need medication. Now, of course, then you have hypertension crisis. This is when your high pressure is high up and you might be unconscious. You might have a very massive headache. This is an emergency state. You have to be hospitalized immediately. Okay. Now, we'll talk about uh, we'll talk about hypertension as what I feel you all should know is that just because you've checked your blood pressure, let's say you've always had a normal blood pressure, and today someone has come, you want to check your blood pressure, and you check your blood pressure, and let's say your blood pressure went up to 140 by 90, 140 by 100. So you should not panic. Of course, that is high, but you cannot call yourself a hypertensive patient just because just one reading is high. So, an elevated blood pressure measurements on at least two separate occasions is required for a diagnosis of hypertension. So, remember, an elevated blood pressure, okay, the elevated blood pressure measurements on at least two separate occasions is required to consider yourself a hypertensive patient. Now, when you check your hypertension, this is very important. Just remember that when you're going to measure your blood pressure, what you do is first of all you have the person who's going to if you're going to measure it, you sit quietly for at least, if possible, for you rest for 5 minutes, and then you check your blood pressure. Then you should sit straight with your back supported, and your feet should be flat on the floor and not crossed. Okay. And while checking your blood pressure, you should not be chatting with anyone or talk on the phone. You should relax, not talking or moving during the process. And make sure that your arm is like, the arm which is being measured, it should be supported on the flat level surface of the on a flat table or whatever surface, and it should be at the level of your heart. So this is very important. Okay, because see, some people, you're checking your blood pressure, and you're on one side you're talking on the phone, and on one hand you're checking your blood pressure, and you're not relaxed. Your posture is wrong. Your reading can be these affect your readings, so you might not have an accurate reading. So just be careful. Like I'll repeat it again. When you're going to take your blood pressure, make sure that you're relaxed. At least wait for 5 minutes, relax, and check your blood pressure, and sit straight. If you're going to be sitting, so sit straight with your back supported, okay, on a chair which has a backrest, back supported, and your legs should be flat on the floor. It should not be crossed. You should not be talking or moving while they're checking your pressure, and uh, yourself should be relaxed. And now let's go to pharmacological treatment of hypertension. These are how to treat your hypertension without medication. First of all, the most important is salt restriction. So like I said, salt is very important because salt causes high blood pressure. Salt restriction, when we say salt restriction, it does not only mean the table salt that you're taking. It also means any food which has high salt content, like pickles, like your preserved foods. Now, these have very high sodium content. So these are also included. weight reduction, you have to reduce your weight, stop smoking, you avoid or limit your alcohol intake, regular exercise, physical activities required, your diet modifications such as reduce intake of food which are high on cholesterol and saturated fat, take adequate intake of calcium, especially magnesium and potassium. Potassium also is very important, and foods like avocados and bananas are rich in potassium. And let's talk about stroke. Stroke is also very similar to same thing which causes the heart attack because of that atherosclerosis formation in the vessels. Now, what happens is these vessels, like we've already talked about, the vessels become narrow, and the blood clots, like they are flowing through the blood, though they are flowing normally. They might encounter an area where there's narrowing of the, what do you call, narrowing of the vessels. There the blood clot gets, it gets lodged there. Then blood cannot pass through that area, and with whatever area that vessel is um, supplying in the brain, it will not, two things can happen. First, if there's no supply in the brain, supply of blood, if there's a blockage in the what do you call, cerebral arteries. Cerebral arteries are the arteries which supply the brain. So if there's a blockage in the cerebral arteries, two things can happen. The area which is supplied by that artery will not receive blood, and it'll get dry, and what we call ischemia. So, or infarction. There'll be infarction of that area. It'll not get any blood, and there'll be dryness, dry around that area. Now, another thing which can happen is that because of the blockage in the artery, there's, the blood is flowing, trying to flow through the blockage. So there's a lot of pressure on the vessels. Now, like we said, since the vessels have lost their elasticity, and they've become hardened. So instead of expanding, what happens is there's more pressure, and the blood is trying to move past that obstruction. The vessels, they burst, and there can be bleeding in that area of the brain. It's what we call hemorrhage. That is how stroke occurs. Now here, see, stroke is the loss of brain function due to a disturbance in the blood supply to the brain. Now this disturbance is due to either ischemia, that is lack of blood flow, or hemorrhage because of bursting of the vessels. There's a collection of blood in the brain. Now, risk factors for stroke include old age, high blood pressure, diabetes, high cholesterol, sleep apnea. Sleep apnea means disturbed sleep. Then you have certain blood disorders like very high RBC count. See, RBC count normal is okay, but sometimes your RBC count can be so high that your blood, instead of being watery and being able to flow normally, they become sticky, and that also causes blockage in your vessels. So very high RBC count, what we call polycythemia, it's a condition called polycythemia vera. Very high RBC count is also not good. Then high blood pressure is the most important modifiable risk factor, which is something which you can modify. Symptoms of stroke and mini stroke. There can be certain early warning signs. You can have a sudden numbness or weakness of face, your arm or your leg, especially on one side of the body. Sudden confusion or trouble speaking. You may slur your words. Suddenly you see one of your friends who was sitting with you, you're chatting, and you feel that, he's trying to say something, but even he's slurring his words. If that happens, you should be alert. You should be so alert that you can come to the conclusion that he might be having a mini stroke or a stroke, or sudden trouble seeing in one or both eyes, and sudden trouble walking. You're walking, and suddenly your gait, or what do you call, your steps you're waddling, or you have sudden dizziness, loss of balance. You can have a sudden or severe headache with no known cause. These are like warning signs. But like I said, not just because you have this does not mean that you're coming down with a stroke. You should not panic, but it's if you have these kind of symptoms, it is always good because all these happen suddenly. It's not something which it is slow. It came up slowly, but these for a stroke, it happens suddenly. So make sure that if you have these kind of things, instead of panicking, you go to the nearest uh, hospital, have a thorough checkup. Now, another identification you should remember is FAST, FAST. Now, F, face drooping. Is there any weakness on the side of the face? Just if you okay, person is complaining of all that signs. Okay, he has come up with all the signs, and then what you do is just see if okay, the person is there any weakness on the side of the face? That is F, the face drooping. Now A, can he raise both his or her arms? Can he or she raise both his or her arms? Ask the person to raise their arms. Can they raise the arms? Arm immobilized. FAR. Okay, and S comes to speech. Speech impaired. Like say, can his speech be easily understood, or is suddenly you feel like the person slurring his words and you cannot understand the words. And the FAS and T, time. If that happens, if these after checking all these, if the person has those kind of symptoms and you checked all these, you feel the person has some slight drooping or weakness on the side of the face, cannot raise his arms, and this one's and speech is slurred, best call emergency or take him to the emergency. Now, prevention of cardiovascular diseases, stroke and stroke are you trim your fat intake, eat healthy, cut down on salt, keep your weight healthy, don't smoke, don't take alcohol, do exercise, monitor your blood pressure and cholesterol, relax and cut down on stress. And if you're hypertensive, then don't skip your antihypertensive drugs. If you're diabetic, don't skip your diabetic drugs. Now we come to diabetes. What is diabetes? Diabetes, it's a disorder in which the cells are unable to obtain glucose from the blood, such that there is high blood glucose level. Now, there are two types of diabetes. You have the type 1 and the type 2. Now, type 1 is usually hereditary, which you're born with. Type 2 is what is usually developed due to our lifestyle diseases, due to our lifestyle, basically. Now, type 1, it's a body's inability to produce insulin. Maybe it's because we are born with some defect in our pancreas, and the production of insulin. It's something which is hereditary, or which we are born with. Then type 2, like I said, it's because of our lifestyle, usually because of our lifestyle. Now, we talk about insulin resistance in diabetes. It's because of insulin resistance. Now, what happens is insulin resistance is that, what is insulin? Insulin is a hormone which is secreted by the beta cells of the pancreas. Now, what does insulin do? Insulin, what does it do is that insulin, it absorbs the glucose from the bloodstream. You take your food, you take sweets, you take carbohydrates, whatever food we have, the glucose, it's metabolized, and the glucose is released in the bloodstream. Now, what happens is that the insulin absorbs the glucose from the bloodstream. Now, what is glucose used for? What is the importance of glucose? Glucose is our main source of energy. That's how we get our energy. It gets metabolized, we get our energy. Now, but what happens is that in diabetes, there's so much of glucose in our bloodstream that that is not required by our body. Excess of glucose. That is why we have what we call diabetes. We have excess glucose in our bloodstream, which cannot be absorbed, and which cannot be absorbed for its utilization. It's there just loitering around in our bloodstream. So that is why we have what we call diabetes. Now, one of the causes that in diabetes we have insulin resistance. The cells become resistant to insulin. So what happens here is that when the cells in our body, they start resisting or ignoring the signal that the insulin hormone is sending to them. The insulin hormone is telling the cells, you absorb the blood glucose from the bloodstream. But what happens is that sometimes there's so much of excess of blood glucose in our bloodstream that there is a reverse effect, and the cells the cells are ignoring the command given by the insulin hormone to absorb more glucose. So it's not absorbing. So that's why the cells are having what we call insulin resistant, and thus the glucose is not absorbed from our bloodstream, and then we have excess glucose in our bloodstream, going everywhere, causing a lot of damage to a lot of organs. Now, like we said, glucose is also known as blood sugar. It's the main source of our energy or our fuel. Now, the warning signs and symptoms are excessive thirst, hunger, frequent urination, weight loss or gain, suddenly weight loss or gain, and without, you feel you've lost a lot of weight and your appetite is the same, everything is the same, but you're losing weight, or you feel you're gaining so much of weight, even if you're not eating that much, you're exercising, but you're gaining weight. It's also all signs of maybe you're coming up with type 2 diabetes. Fatigue, blurred vision, or you have a wound and it's not healing. Those are warning signs. And another very common thing is like especially your vision. You might not know that you are diabetic or your blood sugar is increased, but you feel, you've just you've changed your glasses just recently, and you feel your glasses are not suiting you. You need to know, you need to change your glasses again, and your vision is, even initially your glasses might suit you, but after 1 or 2, 3 months, again you feel you need to change your glasses again. That is sort of it should alert you to the fact that maybe your blood sugar is high, because eyes are eyes are one of the organs which are first, which show the first symptoms of, one of the organs which first show the first symptoms of diabetes. Now, you have your random blood sugar test, and you have the fasting, and you have 2 hour postprandial. Random is, when we talk about random, it means the blood sugar taken any time of the day. So it could be just after your lunch, or maybe 2, 3, 4, 8 hours after your lunch, whatever. But it's not when you take your blood sugar, but not at a proper timing. So it's just it's taken randomly. So normal, when you take it randomly, normal is usually, it should be below 200 milligram, and if your random is more than 200, though though it's written as diabetic, but to make sure that the diagnosis, it's confirmed, you have to do your fasting and PP. Then you also have to check your, what we call, glycosylated hemoglobin, that is HbA1c. That will confirm if you are diabetic or not. But random usually does not confirm. Then fasting, of course, at least fasting. When we talk about fasting, fasting should be at least 8 hours fasting. Okay, let's say you slept at around 1 or 2 o'clock in the morning, and you ate something around, let's say, 1 o'clock, and in the morning you want to do your fasting blood level. So let's say you checked your blood glucose fasting at around 7 or something. So 8 hours have not passed, so that cannot exactly be fasting. At least more than 8 hours should pass for to be a fasting glucose level. Okay. In fasting, normal should be below 100, and in a normal person, but in a diabetic, 126 milligram, it's okay. And if it's 100 to 125, it could be pre-diabetic. Then you can go. Then you have your 2 hours postprandial. Normally should be 140, but if you want 140 to 199, but it's around 200. Pre-diabetic, above diabetic. Now, We talk about glycolated hemoglobin or HbA1c test, or it's also called glycosylated hemoglobin. Now here it measures the amount of glucose which is attached to your hemoglobin. Now this is very important because the importance of this is that you get your average blood glucose level for the last 2 to 3 months. So when you test your HbA1c, the results give you the shows you that shows you your average blood glucose level for the last 2 to 3 months. So it means that if it shows if your blood glucose level has been high or it has been always been well controlled. Now, in a diabetic patient, the ideal should be 6.5 and below. Now, in a normal person, when we talk about diabetic patient, means a chronic diabetic patient who's all on medication. So their control 6.5 and below is considered normal. But in a normal person who's never had diabetes, our ideal should be 6 and below, 6% and below. Now, what happens is that, like you might say, okay, when you test your blood sugar level, like fasting and a PP, like I specifically said, if your fasting is not less, it's not more than 8 hours, and uh, your fasting level can be there can be discrepancies in your result, and even your postprandial 2 hours. What happens is that 2 hours after your lunch or your dinner, if you test your blood, it this also depends a lot on you had for your lunch or your dinner. The blood results also depend a lot on that. So your fasting and your PP, though it's important, but it's not confirmatory. You can't say it's confirmatory that you're diabetic. But when you do your HbA1c test and it shows that your HbA1c is like, let's say 8 or 9 or 10, it means that your blood glucose level has been high for at least 2 to 3 months and it's not controlled. So this is it's sort of a confirmatory test. High risk category of people having diabetes, 45 years and above, overweight. Of course, those family members with diabetes, and if you're during pregnancy, if you can have diabetes during pregnancy, and that also continues to lead to diabetes. If you had a baby, which is what we call a big baby, 4 kgs and above, there's a possibility that you're diabetic. How do you prevent? It can be type 2 diabetes can be prevented, but type 1 diabetes, like we said, it's hereditary, so that cannot be prevented. So maintaining it's all lifestyle diseases have the same, almost all the same prevention. Maintaining a healthy weight, avoiding smoking, reduction of stress, avoiding sedentary life, avoid junk foods, exercise. So you must have noticed that almost all the lifestyle diseases have almost all this. It's basically changing your lifestyle, having a healthy lifestyle. Now let's talk about cancer. Uh, what do you mean by cancer? Cancer is basically an uncontrollable growth of abnormal cells. It is the same cells. Like let's talk about this lung cancer. Now, what happens is that these cells, which is causing the cancer in the lung, are not some vague other alien cells or coming from somewhere. These are same the cells in your lungs, but the only thing is that these cells do not mature. And see, what happens is cells mature and they have their particular functions, but these cells do not mature, and these young immature cells, there's a proliferation, increased growth of these young cells, young immature cells, and these take over the function. They take over they cause a blockage of for other mature cells, and that is what causes cancer, because now the normal cells cannot function because they have been blocked by all uh, these abnormal cells, these immature abnormal cells. Huge collection of these abnormal cells are taking over their area, taking over their region, taking over their functions. And these cells are useless because they're immature. They cannot function as a proper, as other, the normal mature cells. The risk factors for cancer are tobacco use, smoking, sexually transmitted diseases, dietary factors, radiation, asbestos. Now, remember this caution, CAUTION. What the C stands for? These are, if you notice any change in your bowel habits, like you have suddenly you have very hard stool again, you have very you're passing stool like loose motion again, it's normal, and then you keep on there's a constant chronic change in your bowel habits. Then a sore that does not heal, a sore or a wound that does not heal, or an ulcer that does not heal. Then any unusual bleeding or discharge from any place. Okay. Then teeth thickening or a lump. Usually thickening or a lump which is painless. When it's painful and red, it means usually means it's an inflammation, infection. But when it is painless, it should give you another thought. Then indigestion or difficulty in swallowing. If you have indigestion problems, and if you have, there's something stuck, you feel there's something stuck in your throat, and you're trying to swallow and you feel it's not going down properly, it's always good to go for an investigation. Then, or the obvious change in a wart or a mole. Let's say you have a mole which is changing its color, or it's increasing, or there's a lot of, hair growth coming out of the wart or the mole. It's good to have it checked. Or a nagging cough or hoarseness in your voice. Okay, these are, like the name, it's caution, and also remember caution. These are warning signs. Prevention of cancer. You don't, of course, don't smoke. When especially for skin cancer, you have to be very careful. You have to, sunscreen is very important, especially nowadays. Sunscreen is it's a must. Eat your veggies and you cut down on your fat and sugar intake. Eat more moderate protein. Stay active. Get regular medical checkups. Now we go to another lifestyle disease called chronic obstructive pulmonary disease, or what we call COPD. These are diseases which relates to your lungs, your breathing. Okay, what are the symptoms? Shortness of breath, cough, sputum production. Now, tobacco smoking is one of the most common causes of COPD. And the other factors are air pollution, genetics. Of course, these are factors which are not under our control, but tobacco smoking is under our control. Now, prolonged exposure to dust, chemicals, and fumes can also increase the risk of COPD in both smokers and non-smokers. Now, malnutrition and low birth weight is also reason for respiratory disease. So being either underweight or overweight can affect the symptoms of COPD. How do you prevent COPD? First, because COPD is very much related to smoking and fumes, and breathing in fumes and toxic chemicals and all these. So quit smoking, have a healthy diet, take nutrition supplements if malnourished, because if you're malnourished, you're more prone to it again. Overweight, again prone to it. Do breathing exercises. You avoid exposure to fumes and dust. Try to improve both your indoor and outdoor air quality. Then we go to depression. See, I'm going you might say I'm going very fast, but these are just an outline of what, a layman, it's how a layman can understand in a very simple way. I hope you understand it in a simple way. I don't know if I'm I don't know if my explanation is good enough, but I hope you learn something from it, hopefully. So, let's go to the thing. I think this is the second last topic, depression. It's a state of low mind and aversion to activity. It affects your thoughts, your behavior, your feelings, your sense of well-being, like life events and lifestyle that may precipitate depression. Or they can be a lot of reasons for that, a lot of reasons, but these are like the lifestyle and or life events which can also cause depression, like a childbirth. Childbirth can also cause depression in the mother, which what has become very famous now, postpartum depression. Then you can have menopause. During menopause, yes, there's such a lot of hormonal changes in a woman's body that, yeah, it has caused a lot of depression. And financial difficulties, of course, very obvious. Job problems. If you have any chronic disease that if you have a chronic, let's say you have cancer, like chronic kidney diseases or whatever, it can cause depression in a person. Loss of a loved one, relationship troubles. Now, how do you prevention of depression? Now, what we're talking about here is not a medically, what do you call, medication or anything. These are just your change. Like we said, we're talking about lifestyle. So these are how to prevent your depression through your lifestyle changes. Eating healthy, you avoid food in high in refined sugars and saturated fats. It's good to take complex carbohydrates. When we talk about complex carbohydrates, we talk about oats and all these. These are complex carbohydrates. They stimulate what we call the serotonin, which is a feel good neurotransmitter. Okay, and then exercise. You go do what do you call it? It's an exercise is what we call a natural antidepressant, because you go for an exercise, you feel good, you sweat it out, and you reduce your stress. It improves your mood, and once if you have noticed, if you go for an exercise, after finishing exercise, you have that adrenaline rush and you that happy mood. It just improves your mood, and it also boosts your self-esteem. If you do your regular exercise, you feel, like you're healthy. You feel like, your confidence is improved. And, it provides, and then it gives you, like, you sleep well, you eat well, and with exercise, if you have a very healthy diet, it just gives you that inner glow, and it boosts your confidence too. So exercise, I feel, is very important, especially when you're in a, you feel you're going to be in a depressive state. Now, weight loss, if you go for exercise, you have healthy, of course, naturally, you're going to lose your weight. And now, when you lose weight, of course, lose weight in a good sense, lose weight because of your exercise, because of, that what happens is that then that also boosts your confidence. You feel good about yourself. Then you can go for meditation. You practice meditation, like deep breathing, or maybe just repeat and just relax your mind, have a repetition of a phrase. And meditation also helps you relieve your anxiety. Then sleep is another thing which is very important. If you can have a calming bedtime routine, then it help you wind down, you feel fresh. And what I feel is, if possible, nowadays everyone is glued to the phone. What we do is, before sleeping, we look at some we our phones are with us, that. So if possible, if we can keep our phone, we can close our phone, and I have try to have try to have a restful sleep. uh, you'll feel much better, and you'll feel fresh in the morning. And relationship, spending time with positive, supportive, and loving people. If you feel people around you are negative, it's best to, if you can, try to avoid it. It's always good. Try to surround yourself with positive thinking, supportive, and loving people. Okay. And avoid sedentary life, which leads to sedentary life is, um, be active in something, have a hobby, read, take part in something. This helps, this helps you to, it does not lead you to depression. It helps you, it engages your mind, and your mind is opened, and you stay active. So always, have a hobby, read books, or music, play an instrument. If you feel you want to learn something, maybe you feel, oh, I'm 60, I'm 50, whatever, I'm old to learn it. But if you feel it, your dream was to learn, was to play the guitar or something, it's never late. It's a hobby. Just maybe pick it up now and it de-stresses you. Now, the last we're going to talk about musculoskeletal disease. Musculoskeletal, like the name suggests, muscular means it's with your muscles, and your skeletal, your bones. So it's very short. Musculoskeletal disease, healthy diet with physical activity builds strong and healthy bones. Okay, exercise strengthens your bones, it strengthens your ligaments and your muscles surrounding your joints. Now, whenever you're going to go for an exercise or something, the first thing, the most important thing is stretching, because stretching exercises helps with your flexibility and it protects any injury to your joints. So here what we have is, you have your health, be active, you have a healthy weight, it healthy food, it all leads to a good health. Now, minimum recommendation for physical activity by WHO. Children and young people, moderate intensity activity for at least 60 minutes per day. For adults, at least 30 minutes of exercise, most, if not all days, and which should include flexibility. What we call flexibility exercises are what we call stretching exercises, then muscle strength exercises or endurance exercises twice a week, if possible. Now, 60 to 90 minutes to improve when already in poor health or to lose weight. If you want to lose weight, into 60 to 90 minutes. Now, when we talk about moderate exercises, it means brisk walking and swimming, cycling, gardening with moderate effort. But whatever it is, even if you don't have the time, and the minimum, you might not be able to do the minimum recommendation as stated by WHO, but whatever it is, if possible, even 30 minutes, treat for an adult, 30 minutes at least 3 times a week or 4 times a week is also good. It's better than not doing anything. And for especially for not especially, let's say for everyone, even if you don't have the time, you're staying in you're at home, just what do you call, sweeping your room, cleaning your cupboard, you're mopping your floor. These are also all moderate exercises. So even if you don't have the time to do, to go for the gym or go for a normal exercise, these kind of activities, even inside your home, also to helps to improve your health. According to the ICMR report entitled India Health of the Nation State, death due to NCD, like we said, non-communicable diseases or lifestyle diseases, in the country is about 61.8%. It is the leading cause of adult mortality and morbidity worldwide. Now, as you can see that, cardiovascular disease, 6.6%. And chronic respiratory diseases is 4.4%, and diabetes is 2.2%. Cancer, especially breast cancer, is 0.9%. Now, that means that cardiovascular disease is the most it has the most prevalent cause for adult mortality and morbidity. So that's the end of my presentation. I hope I hope it helped you, hopefully, and hopefully there, you'll be able to take in some notes, or maybe some advice from whatever I've already shared, and I hope it helps you in the future. Thank you so much.
Okay, thank you so much, ma'am. I don't know whether you have addressed this question, ma'am, because one participant have put one questions in the chat box. I will read it out. Yes,
Yeah,
ma'am, a
can you
couple.
wait? Let me. Wait. Is it?
It's by say Tin Mang How Kip.
Can you just read it out? I can't.
Yes. I will read it out. Ma'am,
Mm.
a couple of years ago, I had blurry vision for a few seconds on one of my eyes. After some time, it become normal. Is that a sign, symptoms, or warning of stroke?
He had a blurry vision.
Yeah,
A four
for for a few minutes, but
for a
after
few
that, it
minutes.
become normal again.
No, that's like I said, when we talk about blurry vision, see, if you have a sudden blurring of vision, the blurring of vision persists. It persists not for a few if few seconds. What happens in blurring of vision for a few seconds? It could be because your eyes are tired, or you've been like concentrating a lot, or it could be because of that. But if it's just for a few seconds, I don't think it indicates a symptom of a stroke. But how old are you? Like, if you're 40 and above, I would advise that you go for a full thorough checkup. But usually these kind of symptoms, like I said, it's very sudden and it persists. It persists for some time, not just for a few seconds, it persists for some time. And blurring of vision is, like I said, it can be caused by many other things too. So I don't think you should be stressed out, but it depends on it depends on like your weight, your age. If you're in your 40s or late 30s and you're on the heavy side, I would advise you to go for a checkup. It'd be so much better for you. I, or you're less than 40 years, uh, are you like, in your 30s? If so, like, okay, good. So, you don't have any diseases, no? Like, you're not diabetic or hypertensive or anything like that? No history, I guess. Uh, okay, good. If that's the case, I don't think it's a thing, because it was only for a few seconds, I guess. But like I said, even you're in your mid 30s now, it's good to have the thorough checkup. And uh, you don't have to tell me about your weight, but if you're a little on the overweight side, you must have a thorough checkup. Okay?
Okay, I think that one more. Can intermittent fasting help killing cancerous cells? This is very scientific evidence.
There is, I don't think there's a scientific evidence for this. There is no, what do you call, thorough research on this. So it's just what do you call, some people's version of this, so I wouldn't put too much on that. But if there's a thorough research and they've come up with this, well and good.
The next one is
Which
which
one
one
is
is harm?
harmful? Higher systolic
Yes.
and higher diastolic pressure. Both. Higher systolic, like I said, higher systolic means, see, your systolic can be high because of your sudden exertion or sudden stress. But if you rest for some time and you check your blood pressure and if your systolic goes back to normal, that means it's not harmful. But your diastolic, if your because your diastolic is when your heart is at rest, and even when your heart is at rest and your diastolic is high, it is a bad sign. But if both are high, very bad. Okay, then I think those are the questions, and I think
Yes,
I've
ma'am. I
answered
think
those
that
questions.
you
Any
have
more
addressed.
questions? Mhm.
Yes, you have addressed in a very elaborative way, in a very detailed manner. Thank you so much, ma'am, for giving us your time. And I hope that the participant, not only hope, I can see that the participants are really are satisfied with the way you conduct your lectures, ma'am. Thank you so much, ma'am. Let's hope that in the near future also we will be engaging your service again. Thank you so much, ma'am. Have a nice evening, ma'am.
Okay, thank you. Thank you, everyone.
So, dear participant, we will wait for the next resource person. The next resource person will be joining very soon. Okay. One more information is that tomorrow, since we are going to start our micro presentation, I am going to put a list. Okay. I'm going to put a list. So tomorrow morning, 1 to 30, serial number 1 to 30 will be joining. Okay. The rest you don't have to join. Because tomorrow we will be having class only till 10 to 12:30. Okay. 10 to 12:30. So micro presentation will be conducted from 10 to 12:30. So serial number 1 to 40. The rest you need not to join. Okay. Then I will put the serial number by tonight. If anyone have a problem, you can inform me. Okay, you can inform me, and we can consider. Okay, we will consider depending on the kind of the genuinity of your problem. Okay. I will post it the list by night. Okay. But one thing which I would like you to do is that everyone have to be ready by tomorrow. Okay. Don't say that I will prepare it on Monday. I will prepare it on Sunday. By now, everyone have to prepare their PPT. Okay. Get ready with your PPT. Okay, so by tonight, I will be posting sub number 1. I will be posting the whole name list, and tomorrow serial number 1 to 40 has to get ready. Okay. I will put in your WhatsApp group. So let's wait for the next resource person. This will be the last lectures for our program. So we are heading towards the end of our program. Okay.